of the Division of Public Health. Again, thanks to her and her team for the tremendous work that they're doing. Ongoing now, and as we move into this new phase of testing and contact tracing and focusing on ways to track the virus, making sure that we see it rearing its ugly head again so that we can identify it, isolate folks who are COVID-19 positive and protect the community spread. And you're really just doing a great job working on the contract with the organization, NORC, that's doing this work in Maryland as well as here in Delaware, and starting off with our Delaware Army and Air National Guard helping stand that up. A.J. Shaw is not with us today. The director of the Delaware Emergency Management Agency is heading up our testing efforts and really ramping up testing across our state, which is going to be increasingly important as we attempt to identify and control the spread of the virus in our state. And of course, Damian DeStefano, who's the director of the Division of Small Business, and really, I think the person, he and his team, and Secretary Bullock, probably have the hardest job right now, I think, in our response to COVID-19, which is the reopening sectors of our economy, working very vigorously to come up with interim measures to help businesses turn the lights back on and get back in business. I traveled up and down the state, was down in the beach area this weekend and saw some of the creative things being done in restaurants there, particularly as they stand up outside dining areas, I think, which is an idea that came from Damian and his team. It's really been a big hit with restaurants across our state, and we appreciate the good work that you're doing. Difficult work as we ramp up youth sports, a lot of interest and emotion involved in youth sports and baseball and softball and lacrosse and field hockey and all these tournaments that are a kind of a new way of life in youth sports and playgrounds. Was on the phone this morning with the state's mayors, and lots of good reports in terms of behavior at the beaches with respect to mask wearing on the boardwalk and social distancing on the beach. A real success story. What I saw in Dewey Beach as I went down to meet with members of the Restaurant Association and to see some of the challenges that they're facing was just that. Lots of big crowds, quite a big traffic jam from 5 Points all the way through the turnoff to Rehoboth down to Dewey Beach, and same thing coming back with lots of folks returning to the beaches. And challenges, I know, for the towns. The report from the mayors, Mayor Coons in Rehoboth, Mayor Becker in Lewis Beach, was very positive this morning and was similar to what I saw. Before we get started, I just want to reflect on some of the protests and demonstrations that we've seen in our state the last a week and a half. Very positive and peaceful and up and down the state, several in Milford over the weekend and in Dover, and very encouraged by what we see out there and the activity of local law enforcement and the backup of the Delaware State Police. Yesterday, I participated in a prayer vigil that was organized by the Governor's Council on Faith-Based Partnership, and Rabbi Michael Beals, who's the chair, led it off. And we sang and we prayed for peace and justice, for unity and solidarity, and for understanding. And one of the common themes in each of the religious, from each of the worship leaders that presented was the idea of our common humanity and the fact that we each have the divine in each of us. And those two ideas, those two realities, for me, kind of encapsulates the work that we're trying to do together, whether it's responding to COVID-19, whether it's responding to the shouts for justice and peace that we're seeing across our state and across our country. If we think about our shared and common humanity, that we're closer, that we have more similarities than differences, that we're kind of one people. I think that we can do a better job addressing the challenges that we face in the criminal justice system, in education and healthcare, and it was a really uplifting vigil, and I appreciate the commission for its work and for bringing faith leaders together. So we're going to run through the numbers again. Again, we see very positive reality here in Delaware on the ground in terms of number of positive cases. Sadly, a few more total deaths at 424, and again, the number on hospitalizations continues to go down, which is a very positive thing now, firmly below 100 at 87, and again, those are numbers that we know and have a very good handle on because they come from the hospitals themselves, and there's an evaluation of the seriousness of the sickness there. 43, almost 4,400 positive cases in Newcastle County, closing in with Sussex County for the most, 1,500 positive cases in Kent County, and then 4,400 positive cases in Sussex County, flattening out, certainly in terms of the number that are increasing and as a percentage of the total positive cases in our state, which is a good thing. That really outbreak that we saw among the poultry industry workers is similar to what other states are seeing. Was on the White House call yesterday. Vice President Pence and Dr. Birx were commenting on the need to focus on county-specific numbers, and we've been doing that, of course, over the last 2 months, given the situation that we saw in Sussex County. And now, as we've moved into the reopening of sectors of our economy, the need to identify those outbreaks early with intensive testing, to isolate those who test positive and contact folks that they encountered, and to test and isolate them. But the key is to try to get ahead of it, which is a challenge for us as we ramp up testing and the number of cases goes down. We're seeing, as Dr. Birx pointed out in the briefing yesterday, a lot of asymptomatic folks that are shedding the virus, meaning they're not symptomatic, they don't have flu-like symptoms, they don't feel like they're getting sick, so there's not an indication that they should go get tested. And yet they are COVID-19 positive and are shedding the virus and transmitting it to others. And so we need to think through that as we develop our new testing outreach plan to make sure we're testing asymptomatic folks as well, which we are. I think that'll come into focus as we do a better job in partnership with our employers, particularly employers who have a lot of frontline workers with a lot of interaction with the public in our restaurants, in our government agencies, within law enforcement, in our nursing homes, in our other care organizations, really intensely testing those individuals to stay ahead of any kind of outbreak. And that was the message from the White House Task Force and from Dr. Birx and all the governors, because we have a number of states that are seeing increases in cases and outbreaks, and it's certainly a message that we need to embrace here and react to. Again, on our cases by age, pretty much a similar graph that we've seen now for weeks. As we move on to our dashboard, the PPE dashboard looks good. All the vessels are full. The data dashboard, everything continues to head in the right direction, and in particular the current hospitalization number, and you can see the cases by county. Even though they are increasing, they're starting to flatten out. If you take the 90-day view, you see a nice peak and a decline on the other side of that peak in just about all the indicators. The ones we look at the most are new positive cases, percentage of persons who tested positive, and we'll see in a minute a slide that compares that right with our rolling reopening. So we hit our peak. We were on the downturn. This is percent positive. We were starting to test more. At the peak, we were 35, 40% positive. You know, that's back in the April, mid to late April timeframe, where we really saw that outbreak in Sussex County among poultry workers in the communities in which they live, and then consistently going in the right direction, consistent with the CDC guidelines and the White House Task Force. We started our rolling reopening, which was not as stepwise as was recommended by CDC. We kind of rolled it forward, and once we hit a really positive decline in percent positives, and you can see as we've reopened, the percent positive have continued to go down to now they're about 3%. Obviously, we are increasing the number of testing, so that's going to increase the denominator there, and that's important to controlling the virus as we go forward and identifying it in early. So in March, we made what in retrospect, given the challenges that we're facing now with reopening sectors of the economy, our efforts to close the economy, stay-at-home orders, to flatten the curve were difficult, but were successful. Everybody in our state did their part. Some of that was based on fear of the unknown. We know more about the virus today than we did 3.5 months ago. We've learned a lot, but we also know that Delawareans really leaned into it, stayed at home, followed the guidelines. We closed different sectors, as difficult as that was. And so we're beating COVID right now because Delawareans acted responsibility with a sense of community, that sense of oneness that I talked about from our prayer vigil yesterday, that we're all in this together with a shared humanity and responsibility for one another. But my major message today is that the fight isn't over. We've won the first several battles, but we haven't won the war. The virus still is present in our community. It is present at a less intense level, but it's still there. People are still vulnerable to it. We need to protect our senior citizens and vulnerable populations, and we, like every state, is focused on that, consistent with the guidelines from the CDC and the obvious conclusions from the experience that we've had over the last 3 months. We're intensifying testing. We need to ask everyone to get tested so that we have an idea geographically of where the virus persists, and so that we can get ahead of it. We're standing up the contact tracings to identify folks who've been potentially exposed to the virus. So the good news is the hospitalization rates are way down. Let's keep them that way. Let's protect our vulnerable populations. Let's reduce the number of folks that are dying, and let's not wait to get a cure if you need or wait to get care if you need medical assistance. Some people are putting off going to the emergency rooms. We think make sure that if you are feeling bad that you go. There is, as I said, a lot of experience across our country with other states that are experiencing spikes in Arizona and Texas and Florida. I mentioned the other day my concern for the state of North Carolina, who I've been following through this just because they're a little different than us. I know their Governor Cooper well. My sister-in-law lives in the state, so I know the state, and that they've acted responsibly in closing things down and isolating the community at large, and yet they're seeing a spike as some of these other states as well. We did hear the story from Governor Ducey of Arizona the other day. And again, the advice from Dr. Birx was to try to get ahead of it and identify on a countywide or sub-state level basis where you're seeing outbreaks. And again, that requires extensive broad-based testing, and we're attempting to do that at a time when folks are not feeling as threatened by the virus and not as focused on getting tested. But we need to make sure that folks do that. I'm confident that as we continue to partner with businesses, that we'll be able to continue that increasing the number of tests. So as the coronavirus infections surge nationwide, 21 states are seeing increases in the average daily new cases. Delaware is not one of them, so let's keep it that way. We are working, as I said, on a number of challenging sectors, various youth sports and tournaments, playgrounds, businesses that have large gatherings that really present a challenge. And so, we're still going to watch the data to determine the date of moving into phase 3. And again, this is a message to really lean into the basic protections: wearing a mask, keeping your distance from those not in your household, continue to sanitize and wash your hands, and stay at home. If you're sick, and get tested. Wear a mask. One of the things that we've learned through this, at the beginning, we had a little bit of mixed message, if you will, on mask wearing because of some of the concerns about touching your face and not and wearing masks that aren't cleaned often enough. But I think the science is pretty conclusive now that maybe one of the most effective measures or protective measures, Dr. Rattay, is to wear a mask. There is a lot of, I want to wear a mask, I don't want to wear a mask out there. If you can't wear a mask for yourself, wear it for your neighbor. Think about your other family members. Think about your elderly mother or grandmother. Think about your neighbor. Think about the person in the grocery store that you might encounter. And as you go into restaurants, wear a mask. And then when you sit down to eat, you can remove the mask. I think it's a really important one of those things that we really need to lean into as we finish phase 2 and move into phase 3. So as I said, one of the people that have kind of the biggest challenge in all of this, particularly now, is the director of the Division of Small Business, Damian DeStefano, and his team. And I can tell you that they're working really hard at a very detailed level with different business sectors, different activities like youth sports, like playgrounds, getting good cooperation from the mayors and local town officials across our state, but a really difficult job. Damian, thanks for what you're doing.
Thank you, Governor. So, as the governor talked about, over the last 3 months, I think we have definitely asked our businesses to do a lot to participate in helping to flatten the curve. And I think our small businesses have borne the brunt of the negative impacts during that period of time from a business perspective. So the Division of Small Business has been trying to do what it can to assist those businesses. Early on in the process, in March, we launched the Hospitality Emergency Loan Program. One of the first sectors that was significantly curtailed was the restaurant sector and the tourism industry more broadly. We provided businesses with $10,000 loans to cover unavoidable expenses like a lease payment or an insurance payment because we wanted to preserve as many of those businesses as we could and prevent them from going out of business. We've since expanded to also include the cosmetology sector, which was another hard-hit sector. As of today, we've provided 255 businesses with loans and distributed a total of $2.4 million in loan capital. Many of these businesses have come back for a month 2 and now month 3 loan to try to get the resources that they need to pay their rent. And it's a big reason why, as we transition to reopening, many of them, and 50%, over 50% of the businesses that are here are restaurants. Many of them are able to reopen, thankfully, because they were able to get support and get through the period. So we're also trying to do some other things to help small businesses. We partnered with DEMA and the State General Assembly to distribute PPE kits to businesses. They had hand sanitizer, face coverings, and surface cleanser in them. And we're able to get close to 4,000 of these kits out to small businesses throughout our community, with our legislators being on the front line of getting them out to businesses in their districts. And it was a well-received program as people were opening up to have some equipment that they needed to do so safely and at no cost to them as a business. We also have been distributing, we've talked about it a few times, the Customer Protection Standard window cling. As of today, we've distributed over 650 of them. Here's a picture of a business in Dover. It's actually a hotel in Dover that has it displayed on their window. And I think if you go around Delaware, I know I've seen them. I've been looking for them, but I've seen on businesses throughout the state that they do have their customer protection cling. And it's certainly something that we're hearing good feedback from customers about and from the businesses as well. We partnered with the Division of Public Health to put together signs for businesses as we went into phase one so that they could have something to post on their windows to let customers know about the rules, to try to keep both employees in the store and customers in the store safe, and made sure everybody was clear what they needed to be doing as we did reopen. And so we're now in phase two of our reopening. And the major aspects of that are we've increased the occupancy limit from 30% to 60%, which means that many of our businesses can now have more folks in their stores as long as they're able to maintain social distancing for people who aren't of the same household. We've modified the gathering guidance to lift the gathering limit to 250 people, and above 250 can still occur, but requires specific approval from the state. One of the big things that we changed for phase two was that all Delaware families can now access child care services. I know that's been a big support to many folks as they're either, maybe one parent is returning from a long stay of working from home, or parents are trying to make child care options work for them. We released last week youth sports and adult recreational sport guidelines, reopened summer camps, put out guidance for summer school, and finally allowed convention centers and meeting facilities to reopen following both the capacity limits and the gathering guidance. Put this slide up here that you'll see here. There's a lot of information here. There are documents that go with phase one and phase two about both general guidance and industry guidance for businesses. There's a link here of where you can find it. But we also just wanted to make sure we're still being clear about what the most important things are for a business to remember during this period and for customers to remember. And they're the principles of maintaining safe social distancing from members who are not of your household, continuing to wear face coverings, and whenever possible to participate in activities outdoors. They're really the things that people ought to be focused on during this time to stay safe. So finally, the recap of phase two includes here what's not open. And the first two are able to open but first need an approved plan. So that's sporting facilities and venues. These are large facilities where a sporting event might take place. And water parks, which can also open but first need an approved plan. They've been working one-on-one with both our division and the Division of Public Health on putting together safe plans that address some of the unique aspects of both of those types of facilities. And then finally, two businesses that are not able to reopen, indoor children's play areas or recreational facilities, and then sports tournaments and certain high contact sports because of the health risks they continue to pose. You can find the latest guidance at de.gov/phase two. There is, again, general guidance and industry-specific guidance for many consumer-facing industries, but just want to encourage you to remember the core principles: keeping a safe social distance from others who are not of your household, wearing a face covering, and whenever possible, participating in activities outside. Now I'll turn it over to Dr. Rattay.
Before Dr. Rattay, first, Damian, thanks again for all the work that you're doing. Thanks for really focusing on those key points for folks to think about when they go out to eat, when they go out to a retail establishment, when they're going to watch their son or daughter at their baseball, softball game. All those things are really important. And like, we're not doing it just to do it. We're not making this stuff up. And this is public health guidance to protect all the gains that we've made, frankly, in reducing the spread, reducing this illness in our state, so that people can be safe, and so we can protect our senior citizens who are most at risk. So we can circulate and bring folks back to a more normal life. Although the new normal, at least until we have a vaccine, is going to be different. It has to be different, or else the the invisible virus, the invisible enemy is going to resurge. And that's why all of these things are so important, and that's why these activities that we're still working on are essentially activities that involve large gatherings with the folks, in the case of tournaments, coming from other states, not knowing the area from which they're coming and the spread of the virus there, and then being able to track them down if somebody tests positive, and then keeping folks distant from one another. If we all kind of pay attention to those essential guidelines, we'll be able to accomplish the goals, keep that data dashboard where it needs to be, and keep surging forward with our economy and not with the virus. And again, finally, thank you for the signage that you're providing and the challenge to businesses to identify themselves as customer protection standard compliant. Really important signage, gives people a level of comfort that they can come back to their favorite restaurants or establishments and come back safely. I mentioned all the work that Dr. Rattay and her staff have done over the last 3.5 months, but continuing to do and going forward into the future, now uncertain future, but for a long time going forward now with this pandemic, as we prepare for hopefully better days during the summer, and then keep our fingers crossed for the fall with the resurgence of the flu, or the return of the flu, and the potential resurgence of the virus. Dr. Rattay?
Thank you, Governor. Yeah, you just reminded me of what we said when I think one of our first press conferences, is that this is a marathon. We expected this to be a marathon, and this is a marathon, and we are still early in this marathon, unfortunately. And so I wanted to, I stole a quote from Francis Collins, who's the director of NIH today, because I think it really depicts what a lot of people are thinking and feeling right now, which is people are tired. People are tired of this pandemic. We're all tired of this pandemic, and we just want to go back to, normal life. But the virus doesn't care that we're tired. The virus is still out there, and as you see from our numbers, we're doing well. We still have cases, but we're doing well, and that's great. But we so desperately don't want to be one of those 22 states that is increasing significantly and seeing increases in hospitalizations, which several of those states are. We really want to keep this contained, and we believe that is possible. So in thinking about how to prevent spread, we think about how does spread happen. Of course, we know that the more closely you interact with people, the longer that interaction, the more people you interact with. And as Damian was saying, outdoors is better than indoors, certainly. All those things do make a difference. And so when you hear our guidance, we know that at times it is, we have a lot of guidance that we have provided when we're working with multiple sectors. So we really felt today that we very much wanted to focus on what are the key points of prevention to help us not see a significant resurgence while we reopen. So you've all seen this, but we want to reiterate again, the face coverings, so important, and we're going to talk about that a little bit more. The social distancing, so important. And if there's any two things that we want people to continue to be vigilant about taking action around, it's face coverings and social distancing. And of course, hand sanitizing is also important. And so we're going to show a video that, again, kind of shows you what happens when you breathe and when you cough. So this video visualizes or it illustrates airflow when you breathe and cough. And so this person's just talking, a little bit of coughing, and then you'll see a sneeze, which you can see a lot of airflow when a person sneezes. Just wearing a basic face covering, you can see very little of the airflow goes forward or goes outside of that mask. And if you wear a loose-fitting face covering, you see a little bit of airflow. But when you wear one that is below the nose, which we're seeing a lot of people out there not having it covering their nose, you can see a lot come out through the nose. And here, if you have a tightly woven face covering, it protects you, or it protects others from that airflow so much better. So again, a depiction of why face coverings are so important, and something we've been keeping a close eye on is how are people doing with face coverings in some of these other states that are seeing resurgence. We think that this is really a key to being able to keep this contained. So Delaware does have mandatory face covering guidance. Anyone over age 2 should be wearing a face covering out in public, and that's especially when social and physical distancing is difficult to maintain. Children under 2 should not wear a mask, nor should somebody with trouble breathing, like COPD or with severe asthma. People who are unconscious or incapacitated, or individuals who can't remove a mask without assistance should not wear a face covering. Also, want to spend a moment on this one, where individuals who are exerting themselves or with a level of physical activity that makes that increases their heart rate and their breathing and may make it difficult to breathe while wearing a face covering is also a condition in which a person doesn't need to wear it. So I sensed a little confusion this weekend over some of our sports guidance, and I just want to clarify that certainly, all staff and volunteers and parents, spectators, officials, everyone in the youth and adult recreational sports arena, should be wearing a face covering at all times. Players should be wearing them, certainly when they're not on the field. If they're on the field and, participating in exertion, vigorous or moderately vigorous physical activity, they don't need to wear face coverings at that point. But under all other circumstances related to sports, we do want people to be wearing face coverings. I also am hearing that a lot of people believe this myth that is out there, that wearing a face covering can cause carbon dioxide toxicity. And this is not true. Think about the fact that people wear medical masks. Sometimes surgeons will wear medical masks for 14, 16 hours straight. I mean, medical masks, you don't have this as an issue, and it's even less likely with cloth face coverings. You can get a little bit of carbon dioxide building up in a mask, but not to a dangerous level. At the very, very worst, someone could get a headache, but they're not going to get carbon dioxide or carbon monoxide poisoning. So I wanted to clear that piece up. And I also really wanted to close with something I saw last night from our Surgeon General, Dr. Jerome Adams, that I think is a really important point. Some people feel face coverings infringe on their freedom of choice, but if more wear them, we will have more freedom to go out. In other words, wearing face coverings leads to less asymptomatic viral spread, which means more places will open sooner and can stay open. And so he closes by saying, exercise and promote your freedom by choosing to wear a face covering. And I think that really hits the essence of a mindset that will really help us all, I think, make a difference as we move forward.
Thank you, Dr. Rattay, and that is a really important message, and it goes to the change in phases that we've experienced over the last couple of weeks as we've moved to using community-wide, statewide shutdown orders, stay-at-home orders to isolate in a very blunt instrument kind of way the whole community, to one where we're really intensely testing and identifying those who are COVID-19 positive and isolating them, identifying people that they had contact with and testing and isolating them, and then for everybody else, protecting them so that they don't catch the virus from somebody who slips through that protective shield, if you will. And it is so that people can move more freely, so that we can open businesses, so people can go back to school, so that we can go back to a normal way of life. And that's kind of really the trade-off. As I talked to some of the restaurant owners this week, they said, well, these restrictions, spacing restrictions, geometry restrictions are very difficult, particularly for small spaces. And they're right. I said, so if you change those and give them more flexibility, then you've got to pick up protection some other way. And having people wear masks as they come in and as they're leaving, and as servers do the same, that's the level of protection that we need. And so the idea is to be able to create more freedom of movement by those protective measures. So thank you for the work that you're doing. Meredith, I see you have questions. Thanks for coming again. We appreciate you.
I wanted to ask, since the weeks of reopening, have any businesses been penalized by the state for not following the mandatory guidelines?
I am not aware of that. I do know that in the early stages of the reopening, there was discussion about cease and desist order for places of worship, one place of worship in particular that I can think of. Don't ever think it was done. We tried to negotiate some solution to that. It might be wrong, but I don't know if Damian knows the answer to that, or a different answer.
Well, since the start of phase one on June 1st, we have not, I don't believe we've issued a cease and desist to a business. We've had complaints, and we followed up directly with the business and let them know that we were aware they weren't abiding. That's always our first attempt, is to get compliance voluntarily, and that seems to have worked during this first few weeks.
So I
And
guess
just to be clear, that enforcement side is the law enforcement with guidance from the Attorney General. So we would hear about it,
Yeah.
and then try to come up with some accommodation.
So the Department of State wouldn't have any involvement in that, or in terms of just licenses and stuff?
We work closely with Department of Justice on enforcement.
Okay. And looking back on hospitalization rates and it being lower than what early projections had anticipated in terms of the severity, I'm kind of curious why you all think Delaware was able to maintain its hospitalizations and not experience what happened in Queens and other places throughout the country.
I mean, I think one of the big questions that I have, and I don't have an answer, I'll turn it over to somebody more competent to answer the question, is we saw that spike among poultry workers in Sussex County. The first weekend, we saw some severe cases in the emergency room, reported directly to us on our Monday or Tuesday call in Nanticoke, in Beebe, and we got word a few days later from Peninsula Regional in Salisbury. But after that, they never really spiked up high, and it's a question that I have, even though that the hospital or the positive case number continued to rise. It didn't, whether it was because people didn't feel comfortable going to the hospital, didn't feel sick enough. I think it's a question we need to try to answer. I don't know if Dr. Rattay has any thoughts on that. We're lucky that we didn't see it, I think.
Yeah, my perspective is, I think New York and New Jersey were ahead of us as far as they had earlier, higher levels of community spread than we did. So I guess you could say we had the benefit of observing what was happening in New York and New Jersey. And I will say with gratitude, Governor Carney really leaned into this. He saw the risks in what we were observing from New York, and he put the orders in place to have Delawareans stay at home. And I have no doubt that made a huge difference in our numbers of hospitalizations and our numbers of deaths in our state.
And in terms of nursing homes, is there any more expected regulations or policies that the state plans to put out in terms of continuing to curb the spread since it's been hit the hardest?
Yeah, I think the key, and I'll defer to Dr. Rattay, is testing, particularly among the workers. They tend to work in different establishments, and they need to go to work. And so it's an area that we really need to lean into.
Yeah, we do believe that the testing is really very, very important. And our experience so far with testing in the last few weeks has been a positive one. Happy to say that we're seeing very few positive cases among staff. We do believe it's important that we continue to do the testing. We just received more guidance from CDC yesterday that kind of gives us some advice on when we might be able to back off to a little less than once a week. But right now, we do think that that's going to be important. I will also say, I think through this incredibly challenging experience, our long-term care facilities have certainly learned a lot around infection control. And we're all in a better place with having more PPE in stock and knowing what to do when there's a positive case in a long-term care facility. So that's where we are at this point, with the thinking that there could certainly be more cases and a resurgence in our long-term care facilities as they do reflect what's in the community.
And just to follow up, would you say, I guess, for families, like in terms of visiting, that is not we're in the near future, or is there a timeline for that?
Yeah, that's a great question, Meredith. And we know that that's really important, and we know that connection that the residents in these facilities have with their loved ones is so important to their physical and their mental health. We have been working with facilities on innovative approaches to do outdoor visits, starting to think with them about other ways that they can safely visit with family members, maybe an isolation area where everyone's social distanced in the facility. So we are absolutely thinking about those policies. But it is certainly a risk to have individuals coming into facilities, and so you have to balance the pros and cons and do it very, very safely.
Meredith, that's a really important question, and there's so many kind of examples and kind of in all of this of how that the lack of human interaction is almost more painful than some of the rest of it. You've heard me talk a lot about my own mother in these briefings, and my mother is so much happier now that we found a way to get her out of her apartment and for walks. And one of my younger sisters bought her like 1,000-piece puzzle, which takes forever. And everybody had an opportunity to go in and wear a mask and to protect Mom, but it was just so important to the quality of her life. And so it's something that when you think about intangibles and you think about, all the guidance that we try to put in place, those kinds of things need to be factored in, and they're hard. They're hard questions, because the last thing that we would have wanted was for one of us to bring in the virus and Mom gets sick, and she's 89 years old, but she needed that interaction, and as we all do. So it's really a difficult question from a public health point of view. Yes, we had some questions that were pre-submitted, not as many as normal, but.
Yeah, we just have two today. This one's from Matt Biddle at Delaware State News. Did Citizens for a Pro-Business Delaware offer to donate masks to the state? If so, why was this refused?
In fact, Citizens for Pro-Business Delaware did offer a series of masks. We thought the offer was not one made in good faith. They wanted to tell the commissioner and the department how to use the mask and to whom to give those masks. And frankly, the organization, in my view, has an axe to grind here because of a result that they didn't get in one of our courts, and has made it a practice to attack our state. We've worked with lots of organizations that have donated masks. Senator Darius Brown made contacts with a group called the Reform Alliance, and they've made 5,000 masks available, and the commissioner is going to use those as they open facilities in a controlled way for visitors and for inmates. There's been a lot of discussion about the provision or not of masks for inmates. All inmates at James T. Vaughn were given masks. That we had a small breakout at James Vaughn and within the Sussex County work release. I think I say all the time that one of the positive stories in this response to COVID-19 will be the way we reacted, all hands on deck with all our partners to the outbreak among poultry workers in Sussex County. I would venture to say that one of the others would be the way we protected prisoners in our system. There was an article that somebody sent me this week, the title of which was, "There are more COVID-19 cases in some U.S. prisons than in entire countries." And in fact, it noticed that there were almost 2,500 cases just in one prison in Marion, Ohio. In Delaware, we only had 148 positive cases. With, we have on a given day 3,500 to 4,000 inmates. That's an incredibly low percentage. And the commissioner was very aggressive in testing and isolating inmates around those who tested positive. And before we even talked about testing asymptomatic inmates or patients, she tested asymptomatic inmates there. And we also looked at different ways of limiting the population, and the numbers there are significant in terms of various level 4 folks that were detained in institutions and not in their homes. And so there's a lot to be said about the way the commissioner handled the safety of those inmates.
This question is from Matt Biddle at Delaware State News. Does the governor believe there's less of a risk of violence during the protests now? Does he stand by his claim about agitators from out of state? And is he more concerned about Antifa or white supremacists?
Well, I'm really pleased to report that the demonstrations and protests that we've had over the last couple weeks, week and a half now, have all been peaceful. That they had several over the weekend, 2 in Milford, and several in other places, big ones in Middletown. and that's the good news. I've always said that the vast majority of those gathering for these protests want to do so peacefully, but that there are folks that come to the protests looking for to disrupt the community, and have successfully done that in certain cases. And I would also say my concern is for extremists on the right or left, and we've seen both. And frankly, the scariest and most provocative are the ones who come flouting military-style assault weapons. As I attended the protest that started at Tubman Garrett Park and went up and ended at the Newcastle County Courthouse, I would say 6 young men clad in military uniforms with AKs around their neck paraded right by me within shoulder distance, and was very intimidating for me and of course the executive security there, as well as everybody around. And we've seen this on the right and left, if you will, and I just think that that's beyond the pale. It's very provocative. All you would take is one person to do something ill-advised and stupid, and you could have a real seriously terrible situation with that kind of a thing at a large protest like that. And it has been something that has been very antagonistic and frankly counterproductive. Overall, the protests, I think, have brought home issues that we need to confront in our state and in our country. And I'm confident we're on pace to do that. As I say time and again, quoting my dad, talk is cheap. He always wanted to see action, and that's what we hope to do over the next days and weeks and into the future.
I'm back. I wanted to ask, Governor, I just saw that Virginia made Juneteenth a state holiday. I'm curious if you are considering doing the same either this year coming up or in the future years?
Yeah, so it is something that we're looking at. It already is recognized in a ceremonial kind of way, and so we're thinking about ways that we can make it a really meaningful holiday, talking about the history of African Americans in our state and really focusing on, the good and bad of that history, frankly, as most people actually don't know what Juneteenth is, and it was the date upon which slaves got the notice that they were freed and the war was over, and we are working on putting together a program to educate everybody in our state should know that and should know the history there, and I think Juneteenth is a really good opportunity to do that.
And just to follow up on a question I asked Friday, but following what Wilmington is doing in terms of having conversations about the Christopher Columbus statue and Caesar Rodney, are you thinking of directing a similar order just in terms of Caesar Rodney symbols on state licenses, license plates, obviously the names of schools? Is that a conversation that you would direct to have in the state? Yeah,
I think it is. I think obviously with respect to the Wilmington situation, we'll follow the lead of Mayor Purzycki. I know he wants to have that conversations. I think the programs that I just talked about with respect to engaging the Heritage Commission, Delaware Historical Society, in these programs and educating, I think will be really helpful in framing all of that. What's amazing to me, and I'll include myself, before one of the great privileges of being an elected official in our state is you learn a lot about the history, good and bad. And I know a lot more about Delaware history having been an elected official than I otherwise would have known. Much of it wasn't taught, at least in the school that I went to, unlike most public schools, which teach Delaware history, I think in third or fourth grade. In Catholic school, we didn't learn much about Delaware history. So I think it's important, particularly in this moment, in this time, understanding of the real story, the real history of our state. with all its good and bad, I think is important to understanding one another. I think about, again, the prayer vigil yesterday, and that theme, that common theme among worship communities about our common humanity. And unless we understand each other better and understand where our histories and where we've come from and the things, the obstacles that we've overcome, the way we've been treated or mistreated, I think is important to getting to a place where we will see that oneness in each of us. And so I think all that stuff is important. And I think Juneteenth is that kind of a holiday or a day to educate and think about those things as Delawareans and as Americans. So I think we answered all the questions that we have for today. So I just want to reinforce the messages that we will continue to focus on in the days and months ahead as we run this marathon. And it is going to be a marathon, and the new normal is not the normal that we're familiar with. It will include wearing face coverings. It will include social distancing. It will include thinking about our neighbors. It will include working together. But we can get back to enjoying life, particularly the outdoors. As long as you're keeping a safe distance, it's probably the safest place to be as the air is circulating. And we've had really fantastic weather over the last weekend, and very positive experience at the Delaware beaches is what I saw. And I saw lots of people going back to our beaches. There was a story, I guess, a few weeks ago about whether Delawareans would go back to Delaware beaches. I think they proved that they would. I kind of knew that they would, because our beaches are the best, and our beach communities are as well. We have a lot of challenges facing our state. I know we can meet them. We can get on the other side and be stronger. So thank you all for joining us today, and we look forward to seeing you again soon.